are here seeing John for his 1-year follow-up. He had his neograft procedure done here in the office on February 18th, 2018. So he's now just over his 1-year anniversary.
Nearly
2,826 grafts. We see photos of John's hairline taken 1 year ago, and here he is today. And we see the results speak for themselves, really. He's had restoration of his hairline. Everything looks entirely natural. Let's look at John's donor site today. I mean, he obviously didn't get a haircut for his visit. This is how he wears his hair, short. There are 0 telltale signs of having had a procedure. There's 0 linear scars. His hair looks good and has great donor fullness.
I tell people all the time, if I had to do it over again, I would 500 times. Like Dr. Rapaport said, I don't think there's any kind of visible telltale signs that I've had anything done, which is the best part. And now I can enjoy the results from my procedure pretty much for the rest of my life. So
right.
I only have good things to say.
And you were back 4 days afterwards.
Yeah, I was back at work within 4 days from having my procedure done. So there was really no sacrifice, I think, for anyone who's considering having this done. For the average person, it's for the results that you get, it's well worth
pretty easy. Now, you and I both had our donor sites shaved. For me, that I know that was a little awkward. I came back wearing a surgeon's cap. I was at a wedding 2 weeks later. I looked a little weird. But now we're offering this procedure shaveless. So you actually don't have to even shave the donor site. And that means that basically after 4 days, because it takes about 4 days so you can stand in the shower and let the scabs wash away. So basically after 4 days, you can go back to life and nobody knows that anything happened, except that about 4 months later, the grass is growing.
Yeah.
So that's the story. So terrific, really, really good result. You're taking your Nutrafol
every day. And now I think the next step for me is to try and do a PRP treatment, which I've seen, really good results from other people. So I think that would be.
We should be doing that soon. So
yeah.
we will meet again on camera for your PRP.
Perfect.
Sounds good, John. Thanks.